guys, welcome to the Not Rev MD podcast. I am so excited this week. We're going to shift gears a little bit and actually talk about a really cool resource that's out there for other physicians, and really just also hear from another physician who's built her own practice. She gets what it's like to manage the insanity of patients and clinical care and the business side, while also developing a really cool resource, both for her own practice and for others. So with that, I'd like to welcome Dr. Jamie Hale. Welcome to the show.
Thank you so much for having me. I appreciate you.
And I'm so excited because you live in Denver. You're in Denver now, which is, where we were for about 20 years. So, I'm sure our paths have crossed in one way or another.
It seems to be a small world for sure.
It is a small world. All right. So tell me about you and your practice.
Yeah. So my business partner, Dr. Stacy Pilkington, and I built our practice locally here 10 years ago. And we're a small private practice, and we've been around for 10 years, like I said, and we have just gotten to the point where we feel like we're a bit at capacity and we have a hard time fitting patients in and having a hard time seeing patients for acute urgent needs, which is what led us to start SkinRelief Hub, which is really an online telehealth platform that's specifically made for photo-diagnosable conditions, like things like warts and shingles and cold sores and scalp issues, all the things that we get pictures texted to us from family members and patients all the time. And we have built several businesses together. Another one was Long Live Health and Vitality. We manufacture and distribute longevity supplements and have our own skincare line. So it wasn't our first go around starting a business together, but this was definitely a new endeavor in the tech space. So here we are.
I love it. Here we are. I love it. I don't think you can sit still. Neither can I. So
Nope.
I feel like we share in that journey.
We're a bit crazy in a good way, we say.
Okay. So let's talk about your practice for a bit. So you've grown this successful dermatology practice and do traditional insurance-based models. And how has that been for you? Has that been like a successful journey, it sounds like? And then we can kind of transition to the SkinRelief Hub.
Yes. I mean, we started from scratch right out of residency. So we opened our doors on July 1st after graduating and had no patients and built it from there. And we really had the concept of spending quality time with patients, giving them really good care, treating them like family, kind of doing old school medicine. Mm-hmm. And they told other people, and it grew with word of mouth. And so we have this really beautiful, lovely patient base, but we are insurance based, mm-hmm. and we do cosmetics as well. And we've definitely felt the burden of the system, right? Mm-hmm. The burnout of dealing with all the insurance and the prior auth and people's confusion about bills and medical billing. And because it's not straightforward, even to me as a patient, when I'm trying to understand it. So we really were trying to decrease our burden that we felt as physicians and the burnout we were feeling, but also provide a really cool service for patients, which is what led us to find this need in our practice. And we thought, why not us to fix the problem and give ourselves a solution?
So talk to me about what is the problem you're solving with the SkinRelief Hub, both within your own practice or primary care, or say somebody else who maybe could utilize the service?
I mean, most acute urgent issues in dermatology can't be seen for weeks, months, sometimes close to a year. And that's a problem because a lot of these things are pretty easy to treat, but they take time and they come up quickly. And so when you're booking out 6-8 months, you either end up derailing your whole day by filling the schedule with them, or the patient waits and doesn't get good care, or they go to urgent care or primary care and they do their best to give them those tools. But we were the ones that were trained to give them the best treatment and the best education and the holistic understanding of what their condition is, how they got it, how to prevent flares. And so we are trying to kind of fix both of those problems. And then even personally, we're busy moms. I've used a service like this for allergies for my son, and I was so appreciative not having to drag him into an office and getting good care, but not having to leave my home. So I think personally, we understand the value of it, but professionally, we really felt the need to have an outlet for these patients to get really good care, but not have to derail our day or any dermatologist's day to get that care.
Well, and I think you start seeing these in other spaces. Now, I went down a rabbit hole when you shared this, and there's not really a lot of on the market for this. You're kind of the first pioneer on the skin front that I found that was very similar to this, with a problem to solve, a solution, and then also an ability to kind of share this with not just from a patient perspective, but also from a doctor's perspective. I guess talk to me a little bit about what the goal is for that long term.
Right. So there's definitely telehealth out there, and kind of a general way to get health care online.
Of course.
But we were really specific that there's some conditions that are safe to treat via telehealth and derm. There's some that's not. This doesn't replace general dermatology. And so we made our app a bit different than other ones in a sense that it's super simple. Patients go to the website, they see what they're going to be treating. There's kind of an other category, but it really guides them to hone in the issue. The other thing that makes it unique is they don't pay until it's reviewed. So the case is reviewed by the board certified dermatologist. We make sure that it's safe to treat and that we're going to be successful in treating it. Then the patient's notified, and that's when they pay. So it kind of creates this really cool process of, if I go on and I pay this flat fee to get this care, I know I'm going to get good care. So I think that's kind of what made us get it a little different than what we saw out on the market. And then, like you said, with primary cares and pediatricians and OBGYNs and urgent care, we'd love to be the go-to for all of these kind of, oh, I have this rash come in and I don't see a lot of rashes because I'm a primary care doctor. It's going to be forever till this person can be seen. And to have that resource to know, usually within 5 to 15 minutes, that whole process can be completed. So we're really hoping to be that kind of go-to. And then I think there's a lot of direct primary cares now. There's a lot of concierge docs, and they need those kind of other services to help complement that whole concierge piece of providing that holistic care.
Totally. And it's an easy way to say, solve a problem, learn something too, probably at the same time, and then be able to have happy doctor, happy patient.
You got it. That's the whole point.
Whole thing. So then talk to me a little bit about, so this service is cash pay. So this is not being billed to insurance. Is that correct?
Correct. So it's a flat fee. And then during the intake process, the patient does input their local pharmacy. And so if we do prescribe medications, we're using low cost generic medications that they could use their insurance for. Mm-hmm. But also we walk them through how to get coupons on GoodRx. And we really take cost into our minds when we're prescribing these things.
Okay, got it. And I think that obviously if I can go see somebody quicker and I don't have to leave my home, I'm personally going to choose even cash pay, like just make it easy, because mom, physician, entrepreneur, all the things make it hard to sometimes just do simple errands or calling places to even schedule an appointment. I don't know about you, but that is like my pet peeve.
Yeah, you can be on hold for a long time and a piece of your soul dies every time.
Yes, that's exactly right. And I just don't have time for that. So if patients or physicians want to check it out, like what's the best way for folks to find you?
Yeah, I think our website is the easiest. It's SkinReliefHub.com. And then we're also on social media at SkinRelief Hub. Okay. And then doctors, pediatricians, primary cares, if they have any questions or want to find out how to kind of set up a direct link on their website, things like that, our email is info@SkinReliefHub.com.
Amazing. And so what are maybe just top 3 things you do treat? I think you touched on those again, but we'll just repeat those one more time. And then top 3 things you don't treat.
Yeah, I think anything in the rash category, the eczemas, the tinea versicolors, the contact derms, warts, it's a big win for that. And then anything in like kind of the infectious category, like toenails and tinea and all those easy kind of things.
Okay.
The things we don't treat is we do not evaluate skin lesions. So it's not safe to reliably try to diagnose via photograph. No. And we also think regular routine skin checks needs to still happen. So your local dermatologist needs to be a resource. And then we don't treat acne right now for a couple of reasons. One is we really believe, again, you need to have a holistic view of the patient. And this is really not set up to have that back and forth conversation. And then that needs ongoing care to make sure the
Mhm.
patient's getting better, to monitor medication. So we are really kind of clear about the safety of what telemedicine is. Otherwise, it ruins it for everybody if you get it wrong.
Totally.
And we make that clear from the get-go when patients go to the website.
Okay. Got it. And, I think so. I've already been sharing this, and so you do treat peds. That was the one question I
We
got.
do.
Okay,
Yes,
you
we
treat
do.
peds.
Because
Okay, got it.
I think busy moms are going to be one of our biggest
Yeah.
users of this because we don't have time
No, no
to
time.
drag our poor kids in.
No time.
And it's just honestly too, I think a lot of times we spend time educating patients in the office on conditions and they remember maybe 10% of it, or
Totally.
you give them a piece of paper and they throw it away. We include all of that education on their portal that they can go back and access at any point in time. And as a busy mom, I so appreciate that. Like, what am I doing again? And how do I use these creams? And how do I restore the skin barrier for my eczema baby?
All the
So I
things.
think all the things.
Awesome. Okay, that's great to know. And again, I know a huge resource for moms and doctors out there. Before we go, I do want to ask, would you say is your top one or two things that you've done to help build your successful practice? Because I think you guys have done a great job. You have a little mix of some cash-based services, but you have an insurance-based practice. You've grown organically over time. And a lot of our listeners own their own private practice. And so what would you say one or two things that have really helped make sure you're profitable, that you've got
Mhm.
happy staff, happy doctors?
I think number one is treat patients like you want to be treated, right? I think that is how you grow anything,
Of
is
course.
provide a good experience. And then two, I'm going to combine two things into two. I think time efficiency and teamwork. So
Yeah.
I think if you can streamline anything, everybody wins. And then if you can get everyone on the same page, your staff, your, estheticians in our field, or if you have mid-levels at your office or your other physicians, if everybody's working towards the same goal, I think it leads to a lot of success.
I like that. Yeah, we had someone on the other day and really talked about communication and team huddles, setting clear expectations.
Mhm.
And I think running a team, we're not taught how to do this in medical school. It is a skill we have to learn over time. And obviously, practice makes perfect. I look at running a team now as much different than when I was running a team 10 years ago. Um, but it's good to hear that it can be done. You have obviously a great, wonderful practice in Denver. Now, this really cool resource, both for patients and other practices. So it's really exciting. I'm really happy for you. Congrats.
Oh, thank you so much. It's been a journey for the two of us, but we're super grateful for people like you, for your encouragement. And I think more physicians need to be problem solvers and solution makers because we're the ones that know the burden of it all. So I just
Totally.
encourage anybody that's thinking about it to go for it.
Yep. I mean, that's why we opened up our billing company because we were seeing friends of mine that were struggling. And I love a good policy and procedure and a good spreadsheet. So I'm like, I think I can help. And, we've been able to grow steadily because of that. And obviously, you saw a need, you've created a resource, and now you're able to solve problems, which, again, at the end of the day, I think if physicians, like you said, stay on top of managing and solving problems for healthcare, then I think it's just going to be a better place. So.
I totally agree. It's super inspiring to talk to you. So thank you so much.
No, thank you so much for being on. And I will put all the show notes in and all the links for people to find you. And of course, for the listeners, if you find this episode helpful, share it with others. We're trying to, share a resource related to the SkinRelief Hub and Dr. Jamie Hale's practice. So feel free to share it with others that you know, and appreciate you being on the podcast this week. Thank you so much.
Thank you so much. Have a great one.